Hello everybody, it's Dr. Damico here at Skincare Fort Worth. Continuing our series on Botox in the face. We've already talked about the forehead area and the frown line area. And that leaves the third common area that we do in the face. And that's the crow's feet, or these lines that you get off to the side of your eyes there. That sometimes they're there at rest and sometimes they're only there when you smile. But if they're there only when you smile now, someday soon they'll be there even at rest. So it's a good thing to knock them out before they turn into permanent creases. So what you'll see is these little wrinkles that come along the side of the eye, and it's because this muscle right here, called the orbicularis oculi muscle, when it contracts, these fibers here contract and they bunch up that skin and wrinkle it. So that's the muscle of the crow's feet, and that's why you get crow's feet. Also, this one pulls down somewhat here, and that causes not only this wrinkling, but it also actually pulls down on the brow. So like we talked about last time, that the frown line muscles are brow depressors, muscles that pull down on your brow. So are these upper fibers of the orbicularis oculi muscle, part of the brow depressor group of muscles. So when we do a brow lift with Botox, we treat these muscles in here and this upper area of muscles here to get everything to then relax, and so the eyebrows and the brow can come up. That's just a nice side benefit sometime of doing crow's feet treatments, is you can get a little bit of lift in the brow as well. But by and large, we put the Botox in 2 or 3 or so places on either side. Usually it's about 10 to 12 units per side. Sometimes we get by with 6 or 8 units per side, but I would say on average it's 10 to 12 units per side for a female patient. And again, for men, it's going to be more because these muscles tend to be bigger and stronger in men, and more muscle mass, the more Botox you need. So men usually start with 12. Often I'll start with 15 and even go up from there in men. Also, if you have really long crow's feet that come way back here, like some people do, sometimes we have to put a couple of rows of Botox. But usually, we just split up the dose into several more sites. We don't necessarily have to add additional Botox. We just add additional injection sites to cover a bigger area. So that's gonna be how we get rid of the crow's feet. Now, sometimes people have this one line that comes right out from the side of the corner of their eye there, and that one's sometimes a little more difficult to get to go away with just Botox alone, because it's not just because of the muscle that it's there. It may be because some of the skin is dropping down and causing a little crease from the skin overlapping. It's not just from muscle movement. And the other thing is, some people will get crow's feet come way down into their cheek area here, and we can't really go after those with Botox because you can't put Botox in here without causing problems, interfering with some other muscles, particularly the ones that move your mouth around. So we can't chase these lines down here. Usually that turns into a filler situation. So that's the crow's feet. Here, let me put our usual 10 to 12 units per side here, and same 10 or 12 on that side. So you can tell if you're a female and you want to say all the work, so to speak, all the 3 main areas done, it's going to be 10 or 12 units per crow's feet. On average, 20 units here in the frown lines or glabellar, and somewhere between 10 and 16 units in the forehead. Usually it's about 12 units for most of my patients. So an average complete face is going to be about 50 to 60 units of Botox. And so that's a pretty average number. Some people need a little more. Younger patients might be able to get by with the lower side, maybe even 45 or so units. that's pretty much it for the most common areas of the face that we use with Botox. And we can talk about some of the other lesser areas that we do, like the areas in the lower face and some special treatments around the eyes to get rid of some of these little lines that people get in here. And there's just a variety of things you can do with Botox, but those are the most common things. So looking forward to seeing you all soon. We might come up with some more topics to talk about with Botox, or maybe we can start talking about some filler things between now and then. Otherwise, everybody stay safe, and we'll see you later. Bye-bye.